Sciatic nerve pain can be annoying, it can be a doozy, it can be something you definitely want to get treated. I treat people with sciatic nerve pain weekly, and we go over some stretches to help reduce that nerve pain but improve mobility. And so those things I want to go over with you today, and we're going to start at the source. We're going to work our way from the back and travel the pathway of the nerve to give you the most relief possible. You're going to want to follow along with me. I'm going to do the reps and sets with you. I'm going to tell you how it should feel and how many times you should do it. You're going to want to lay down on the ground or get on your bed. You're going to want to do something or be on something comfortable, and we're going to get after it and have some fun. Let's get started. Before we get started, I want you to know that you're going to need a strap. This is a stretching strap. It's like $6 on Amazon, or if you want to use a leather belt, it just can't be stretchy, and we're going to loop it around our foot. We're not going to use it right now, but we're going to use it in a few exercises. So like I was telling you about, we're going to start at the source of the discomfort, which is the lower back. We're going to start with moving our lower back, our hips, and then work our way down to the nerve. So hang with me. We're going to have some fun. You're going to want to lie down. You're going to want to get on the bed or on the floor. You're going to want to be in a hook line position, so knees are slightly bent. And we're going to start here. So when we talk about improving sciatic type discomfort, we want to talk about tissue irritability. And so none of these should cause you discomfort in the moment. You may feel stuff, but you should not have intensifying radiating pain down the leg. That is an absolute truth. If you are having that, you're going to dial back either on the range of motion or intensity. So the first one I'm going to start here is the pelvic tilts. Since we're starting at the back, we're going to move the back. And what I'm doing is I'm just flattening my lower back to the table. It's a rocking of my pelvis. It's going this way, then it's going this way. It's going forward. I'm kind of poking my butt into the table, and then I'm rounding and lowering my back into the table. We're gonna do about 30 of these pelvic tilts. Now, don't worry if you can't remember how many. I'm gonna put this into the description of the video, but motion is lotion when it comes to nerve pain and back pain. So we're gonna do more rather than less, but it's gonna be simpler exercises. And so I'm at about 8 or 9 tilts now. We're gonna move into 30, and we're just listening to our body. Now, what I feel is just some pulling in my lower back when I tilt back, but when I treat with my clients who have sciatic pain or nerve pain, they're gonna notice a loosening up phenomenon, and that they may have a little bit of tension in their back to start, but then it'll start loosening up, or they're gonna have some pain down the leg into their glute or hamstring or calf, and that's gonna start to improve. Now that we've done about 30 or so pelvic tilts, we're gonna move into lumbar rotations, which is the rotation aspect of your spine. Now, when I rotate to the left, it's closing down a little bit more on the right side of my spine, and when I rotate to the right, it's closing down a little bit more on my left side of my spine. So if you're having left leg pain, expect that you're gonna be limited a little bit more when you rotate to the right. And if I'm having right leg pain or sciatica, expect you're gonna have more limitations when you rotate to the left. Now, when I do this, I'm stopping when I feel my back start to come off the table. Again, 20, 30 reps is to be expected, total reps, so 10 to 15 on each side. And I'm not trying to force my body past a range of motion that it can do. It's okay if you have a little bit of popping. It's okay if you want to widen your feet a little bit. It's okay if you want to do that. Just listen to your body. My body's telling me to stop here, so I'm going to stop there. I'm not going to add my hands. I'm not going to force more into the movement. I'm going to rotate, and as I loosen up, I'm going to notice I'm going to go further and further. This is a great one. I think I'm about at that 20 to 30 reps or so. I love doing this exercise. Not only is it helpful, but it helps reduce some of that leg pain. You can also tell my speed. My tempo is slow and controlled because I'm doing a little bit of self-reflection and awareness throughout, and it feels really good. All right, so we know that the nerves start in your back. We've moved the back into flexion, extension, and rotation, and now we're gonna stretch out the glutes. And so this is gonna be a one-sided exercise. You could do it on both if you'd like, but if you're having left-sided leg pain, I'm gonna have you straighten the right leg, and you're gonna grab the left knee, and you're gonna pull over, a good hard pull and relax. That sciatic nerve exits the glute near the piriformis and goes down the hamstrings. And so since we've moved the back, we're gonna now move the hips, and we're gonna give a good yank and loosen up that glute. Now this one feels really, really good. What you're gonna notice too is I'm stopping when my hip's starting to come off the ground, because that means I've stretched the muscle. If I'm having groin pain, what I'll do is I'll just change my hand placement and I'll grab more towards my ankle, and that will allow me to change the angle of pull without having groin pain. Now a good hard pull, 20 reps, loosen up that muscle. Absolutely okay if you want to do both sides. It's going to be more effective if you do it on the side that you're having that achiness or down into the hamstring. What's really interesting too is that with a pinched nerve, sometimes you can have glute pain and calf pain, but no hamstring pain. It can skip areas, and that's completely normal. As you're going through these, especially these first 3 ones, you should notice that you're loosening up and feeling better. And if you could tell, my range of motion is much better than when we started. Now, for this last one here, we're gonna move into what's called nerve glides. This is a very effective treatment for sciatica and nerve pain, but it's really how you do instead of what you do. And so I'm gonna go over how to do that. So you're gonna go put the strap over the ball of your foot, so it's towards the end of your foot. You're gonna lie down, and I'm pretending that my symptoms are on my left side. If they were on your right, you would just do it on your right side. Now, my first one here, my leg's gonna be slightly bent, and I'm gonna grab, pull, and relax. Pull and relax. Now, what you're noticing is I'm stopping when I'm having symptoms or tension, and I come back. But I don't have to go all the way back down. I just pull and relax. Pull and relax. Pull and relax. Okay, you guys are getting the point, and guess how many reps we're gonna do? 20 to 30 reps. We're gonna loosen up that nerve. Now that we've loosened up the glutes, we're gonna get the pathway of the nerve nice and loosened up so we can be successful with reducing the symptoms of sciatica. We're gonna pull, and I don't know if you guys can tell, but I'm starting to loosen up. I'm getting more range. It's really, really good. So this one's more hamstring focused, so you should feel it into the hamstring area, back of the leg, and really nowhere else. Now, as I do my 20 to 30 reps here, I'm just doing a little self-awareness. If I'm starting to have some tingling in my foot, I'll bend my knee and just relax and come back, and I will just learn my body and listen to my body as we go. Oh, it's a great stretch. Okay, I think I'm about 20 here. So now is the nerve glide. So we're gonna straighten the leg, we're gonna lock out that knee, we're gonna start much lower, we're gonna pull back on those toes. So lock out knee, start lower, pull back, and now come up. Ugh. And I know you guys can see that difference in range, and this is a much different feeling. And this is the exercise that knocks sciatica out of the park. This is the one that I've had the most success with. But again, with higher reward comes a little bit higher risk in that you can overdo it with this, and you don't want to do that. So knee straight, pull up, get that nerve nice and loosened up. Guess how many reps? 20 to 30. You're seeing a trend here. How do you choose between 20 or 30? I don't know. If it's your first time doing it, do 20. If you have done this for a couple days, do 30. Or if it feels good, just go for 30. Now, it is normal to have some tingling into the foot. I'm having some of that right now. And then I'll just bend my knee and relax, wait for it to go away, straighten, start low, and pull back up. Oh, I don't know if you guys can tell, but my range of motion's improving. This is the exact thing that your leg does when you are standing and try to bend over with your leg straight. You are tensioning that nerve, and you are working into that sciatic nerve, which causes sciatica. Okay, 20 to 30 reps. Now for the capstone exercise, I'm gonna shake it out here. I'm gonna have that same thing, knee straight, leg straight, and I'm gonna pull over and up. Oh my gosh, and that is the entire pathway of the nerve. And this is the money maker. This is the one that you're gonna feel that leg work. So I'm pulling over across to my body, leg straight, toes pulled back. Ugh. You can see how this strap is really helpful because it allows me to relax my leg and pull. Now my leg's starting to cramp up towards my hip. I'm gonna relax, straighten, lock it out, pull, and come over. Guess how many reps? I got you here. This one's only about 10 or 15 reps. This one's a little bit more intense. So we're gonna take our time and go a little lower. Perfect. So this is the more aggressive nerve glide. So with all of these exercises, we've loosened up the back, we've loosened up the muscles, and we loosened up the nerve. The only time that I've seen people get worse from this is when they do too much too fast. So it's either too much range of motion or too many reps. If you kind of control those things and just listen to what I'm telling you and listen to your body, you're gonna sit up from these and you're gonna feel looser and have less sciatica type discomfort. Went over some of my favorite ways to loosen up the sciatic nerve. And if you want to, if you're having severe discomfort or you just wanna loosen up the other side, you can do the other side as well. But it's important to listen to your body as we go through this because your body's gonna tell you if you've done too much, too fast. Hope you guys can take those exercises and enjoy what I've seen help many, many patients with their sciatic type discomfort. Give me some feedback. Let me know what you guys think, and let me know if you have any questions. But as always, guys, stay healthy, keep moving, and take care of yourself.